Well, hello, this is Dr. Murray from Ray Naturally Integrated Health here in Hastings, Nebraska, and doing a short video here for you today. And our topic here today is the four ridiculous things that doctors say that keep you from being healthy. And it's an important topic because lots of patients will come in and they'll say, "Hey, my doctor is saying these things." And it's just sometimes it's just not true. And the things that our physicians tell us, they matter because they're telling things from a position of authority. And so it's important for us to get through these four top things that physicians say that really keep you from being healthy. So the first thing I want to talk about is this concept when they come out and they say, well, you know what? You're talking about being tired and wore out all the time, or maybe you have diabetes or cholesterol, and they start saying, well, you're just getting older. So many patients come in, they say, well, you know what? That's what they said. I'm just getting older. The problem with this is when you use that as an excuse, when the reality is that there's other reasons why you do have fatigue, why you're having dermatitis or issues like that, or why your digestion is slowing down, or why your blood sugar status is changing, or why your cholesterol or your blood pressure is changing, and you just say you're getting old. What is their next response? Take this medication. That's the next response. And that is not, first of all, that's not always necessary. In fact, it could be also deleterious or damaging and harmful for a person to ignore the true reasons or the background reasons why, the foundational reasons why this person maybe has fatigue. Maybe it's because their sex hormones are off. Maybe they have true deficiencies. Maybe they're actually eating something that they shouldn't. And maybe there's also other things in their lifestyle that's affecting their cholesterol or their blood pressure, and it has nothing to do with just getting older. It's ridiculous. It's one of those ridiculous things that doctors say that really can keep you from being healthy, because if that's all you're doing is just taking the medication, that is not dealing with the root cause of the problem. Is it possible that age has something to do with some of those problems? Well, sure it is. But don't let them tell you that it's just that you're just getting older. That is a cop out. That is cheap, and it doesn't allow you. It doesn't get to the root cause of anything. And just taking more medications might actually make your overall health status worse. You got to get the root cause. Number two, um, how about this? Is that when you have pain, you go in with neck pain or back pain or maybe hand pain, and they say, you know what, you have arthritis. You have arthritis, and they just this kind of a blanket paintbrush approach over every pain that comes in their way, and they say, hey, you're just getting arthritis. In other words, they're saying you're just getting old. But they say, here's your x-ray and here's your bone spur that we see on an x-ray. See, that's arthritis. Now I'm telling you what, you can go in with neck pain, back pain, and you have an x-ray taken, and your back pain, neck pain, or maybe wrists or shoulder pain started up, and they take an x-ray and you see bone spurs. Maybe you see a lack of joint space. You see lots of changes on x-ray, but those things have been there for years. Yet you maybe only had started having pain maybe a week ago or 2 weeks ago or 2 months ago. Bone spurs and degeneration, it takes months and months and months and years for those things to take place. So when they point and say, see, here's your problem. Here's the arthritis. Now you have to take what? The medication. Folks, there's people that need to take medications. I am not against medications. So talk to your providers about those things. But the reality of it is that you can, when you see pain on somebody, on pain in the wrist or pain in the knees or pain in the back or pain in the neck, oftentimes that is related to inflammation that you and I can have an impact on. Because again, you can take x-rays on somebody, have bone-on-bone degeneration, and they have no pain whatsoever. And other people can have a perfect looking joint and they have tons of pain. So the difference is inflammation, and you can deal with your overall inflammatory status. We see it all the time where people have even their inflammatory markers, their SED rate and C-reactive protein come down without taking a bunch of steroids, without doing extra surgeries, without doing a bunch of extra pain meds. That's the logical progression is, well, there's the arthritis, you need the pain med, you need the steroid, and you need the surgery. You might need those things, But oftentimes, those things can be mitigated if you get to the root cause, the inflammation that's there. So when they just say you just have arthritis, that's one of those things that's ridiculous that some physicians will say, and it's keeping you from truly optimal health, from being healthy. Number three, how about this one? Supplements don't work. You ever heard that one before? That is one of those ridiculous things that doctors say that keep you from being healthy. Why do I say this? Because almost every nutrient supplement is what? A prescription item. From sodium and potassium to calcium, vitamin D, you can get fish oil as a prescription. All those things. So to say that they don't work, it's much more nuanced than that. Because yes, we know they work. It definitely does work, because if you have, for instance, low potassium, you're going to have problems. You're going to need potassium. If your vitamin D is low, you're going to have problems. If your omega-3s are low, you're going to have problems. You need to deal with deficiency areas. Where you start to get into problems is saying that supplements always work, because there are some people who are taking supplements and those supplements are not working for them. That's why it's important to do proper testing, so you actually know. Not to test is to guess, to test is to know. But when a physician says supplements don't work, they're totally ignoring not just the body of science that's out there, but also the FDA approvals for also certain nutrients as well. So again, that's one of those ridiculous things that doctors say that really can keep you from being healthy. And the fourth thing we'll talk about here is, well, you know what? Your mom had that condition or your dad had that condition, so you're going to get it too. So from heart disease to hypertension and diabetes, as well as even osteoporosis, well, you know what? Mom had it, so you're going to have it. I can tell you we've had multiple patients. I'm just thinking right now, two of them right off the top of my head, those with osteoporosis that have reversed their condition, those also that have had in their family history have had diabetes, where their mother had diabetes, but none of the siblings, none of the children have diabetes, because they have been attentive to their health. Your genetics, it is important, but your genetics are kind of like a gun, and the environment pulls the trigger. We have to always remember that your environment and your genetics, they work hand in hand. And yes, if you may have a genetic predisposition towards having problems, but that doesn't mean you will. So it's important to give your body what it needs and take away what it doesn't need. And don't let somebody just tell you that you're going to have this problem because your mom had it, because that is not true. That is one of the ridiculous things that physicians sometimes say that can truly hold you back from being healthy. Because when they say these things, they say you're just getting old, or you just have arthritis, or supplements don't work, your mom had it, and so you're going to have it. That just keeps you from actually getting after the root cause of the problem. And it makes you, kind of puts you in a category of, well, I guess I just have to take this medication. Maybe you need a medication, but I'll guarantee you this: you are not deficient in simvastatin. You're not deficient in Lexapro. You're not deficient in lisinopril. You're not deficient in naproxen, but you can often be deficient in multiple different nutrients, and also deficient in an anti-inflammatory diet, right? Or lifestyle factors, things that you've got to do to help your body to get healthy. That's what we do in our office here, is getting the root causes of the problem. Give our office a call. Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.